Hello, I am a treating doctor. I just reviewed the MRI of your wife and it shows a tumor in her left brain.
Huh? Are you serious, doctor? I thought she only had some nausea and...
The tumor may have compressed some structure of the brain that give rise to the symptoms, so she will undergo surgery tomorrow.
How is her condition right now, doctor?
I'm not sure, but I have been informed that there is nothing serious with her. So, any further question? So if there is no questions, I got to go now. So I will see you tomorrow. Thank you. Hi Encik Azman, I am Dr. HAZIQ from Neurosurgical Department. Sorry to keep you waiting. So how are you Encik Azman? Are you okay?
I am worried, doctor, about my wife. How is she, doctor?
Before I update about your wife, can you tell me a little bit about what has been going on with your wife, Encik Azman?
She complained persistent headache and was very sick last week. I found her unconscious today, hence I brought her here, doctor. I hope there is nothing serious with my wife, doctor. Thank you, doctor.
I am sorry you have to go through this, Encik Azman, but I would like to inform that your wife has brain tumor, so she needs surgery, and the prognosis is still unknown.
Oh no, doctor. I thought she only had normal headache.
Don't worry, Encik Azman. We will try our best to treat your wife. The most important thing is to alleviate her symptoms and improve her conscious level after the surgery. I understand how you feel right now, Encik Azman. Hopefully, you are strong enough to go through this difficult time. If you have anything, please let me know. We are here for you and your family. So, any further questions, Encik Azman?
No, doctor. Thank you for your effort.
You are welcome, Encik Azman.
Hi and Assalamualaikum Puan Aminah. How has the baby been so far? Waalaikumsalam, doctor. Alhamdulillah, my child has started showing positive signs, but he is still not fully recovered yet. I am so happy to hear that. However, may I know, has the child already been vaccinated? I don't remember doing so because I don't think vaccination gives benefit to humans. Okay, this is what happens when you refuse to have your child vaccinated. The child will get sick, and this somehow becomes a threat to our community. Unvaccinated children are at increased risk of acquiring and transmitting vaccine-preventable disease. Okay, that is really rude, and there's no need for that.
Amazing!
Would you tell me more about why you do not want the vaccine? I've heard that herd immunity makes it possible to protect the population from the disease, right? Including those who are unvaccinated. So why should my child get a painful shot if herd immunity has been achieved? Okay, it is true that we have reached the herd immunity against the disease, but the disease has not yet been eliminated. So there is possibility for the child to get infected. But vaccinated individuals are less likely to be infected compared to unvaccinated people, and they largely protected from the worst outcomes of infection. And if one person thinks about skipping vaccines, chances are that others are thinking the same thing, making the spread of disease from person to person more likely to occur. So, what are your thoughts now about getting your child the vaccine after she has fully recovered? Oh, I get it now. I agree to have my child immunized after this. Do you have any other question, Puan Aminah? No, thank you, Doctor. Welcome, Puan Aminah. As usual, please do not hesitate to ask any question to me and other staff around here.
Oh, Anis, right? Oh, okay. Anis, I want to tell you that just now I gave you an injection, right? Unfortunately, I forgot to record your injection as I have to be somewhere urgently.
That's funny.
Okay, then there was another nurse right who administered an injection to you, and you got 2 doses in total, but you don't have to worry.
I was such a caregiver nurse.
Sorry, what is it?
Am I going to die?
No, you're not going to die that instant. Chill. We'll be monitoring your blood sugar level and we'll manage it from there. Okay, and you will be experiencing hypoglycemia symptoms.
The feeling is irritating.
Oh, I bet you have experienced that before. So as you can see there's this button. So if you press the button, the nurse will come and you tell them what happened actually. I have to go because I'm very busy.
You didn't even apologize to me, and I'm going to ask my mom to sue you. You want to sue me? I don't even bother. Assalamualaikum Anis, and good morning. How do you do today? Yes, I'm good, thank you. I'm glad to hear that, Anis. Anis, I'd like to apologize in advance because I have something important to tell you. This is in regards to a medical error that you encountered. Me? Yes, I am deeply sorry for what occurred. Your doctor has already been notified. This is a rare occurrence in the hospital. Would you like to know more about what occurred to you and let me explain? Yeah, of course I do. Alright, Anis. This morning, you have been given an insulin injection around 8 a.m., right? And it was given by me, do you recall? Yep, I can recall. Okay, normally, after we have attended to our patient, we will immediately update the patient's record on the computer. Unfortunately, there was an emergency at the time, so I had to rush to the patient and missed updating the record. I am deeply sorry that this occurred. And Anis, do you remember Nestor showed up and gave you another shot? Yes, I do remember. So Nestor showed up because she checked your record and saw that you hadn't received your insulin injection. As a result, she administered an injection to you. For the time being, we must keep a close eye on your blood sugar level. This means we will need to take your finger prick test in the coming hours. Do you recall the signs and symptoms of low blood sugar, Anis? I do recall this, yes. Okay, you may notify me or nurse too if you are having nausea, dizziness, or any other symptoms that are disturbing you. We are taking this seriously, therefore, we will document this incident. Hopefully, no more errors like this will occur in the future because we will refer back and learn from it. Do you have any questions, Anis, before we take our leave? No, I don't have any questions, nurse. Thank you for telling me.
Okay, hi Ahmad. Okay, from our investigation, we are diagnosed with gonococcal and co-infected with HIV.
Is it that bad, doctor?
Yes, it is so bad. Are you sexually active? Because this is a sexually transmitted disease and it's only occur in person who is sexually active.
Yes, doctor.
Do you wear condom?
I rarely wear condom. My partner refused to wear it because he liked it raw.
I'm sorry. So you're gonna say your partner is a guy and you are gay?
Yes.
Aiman, this is why homosexual is haram in Islam. And it's berdosa besar, you know. You are Muslim and you should aware of this. You know the story about Kaunu, right?
Yes, doctor. Yes.
Then, how come you still doing it? Come on, Aiman. You know how HIV can affect your life, right? Once you get HIV, no one wanna be friends with you. Now it's too late. If your parents know about this, I'm sure you'll get kicked out of your house. Hi Ahmad, how are you? Hopefully all is fine with you.
Alhamdulillah, doctor. So far I'm okay.
Good to hear that, Aiman. Okay, just to recap from our last visit, you presented with a penal discharge and ulcerative skin lesion around the area, right? Hence, we decided to do a few labs investigation to help us in making the diagnosis, right? Just want to follow up. The symptoms still persisted or getting better after we started the empirical therapy with antibiotic.
Antibiotics did help in reducing the discharge, but it is still there and not much improvement in terms of the skin lesion. Doctor, is there any update on my lab investigation?
Yes, the lab result is here. I'm sorry to tell you that you are diagnosed with gonococcal and co-infected with HIV.
Is it that bad, doctor?
Yes, it is bad, but you shouldn't have worried. Before that, I got some questions that I need you to answer. Okay, first, are you married?
No, I'm single.
Are you sexually active?
Yes, but only with my partner. Never done it with anyone else.
Do you wear condom?
My partner refused to wear condom because he liked it raw.
Okay, I'm sorry, Aiman. I think this is an important question. Are you practicing male-to-male relationship?
Yes, doctor.
I see. Okay, man. I think you need to hear this, but I hope I didn't offend you. Risk of contracting HIV is really high in sexual activity, especially in male-to-male patient.
Did I get HIV from my partner?
Maybe yes. So that's why I'm gonna set up an appointment with your partner for contact tracing. Okay.
What about my diagnosis?
Okay, Iman. Don't worry. Later after we get the result from the contact tracing, we are gonna start heart therapy. Don't worry too much. It's my responsibility, and I will guide and help you.